Hello, my name is Anthony Freeman, and I'm in Group 2 with members Essence Elliott, Maya Young, and Yasmin Brown. And I'm doing C for our discussion for the project for Group 2. Discuss the following barriers of accessing healthcare. Number one, personal and family. A, acceptability and medical mistrust continue to be a struggle for many African Americans. For generations, African Americans have not been properly accepted or treated by healthcare medical professionals. Cultural barriers B have been a continuous battle in healthcare. In some instances, African Americans have been treated poorly due to their race and cultural background by the United States healthcare system, and culturally clueless providers that don't understand their background and culture. Healthcare providers can work to improve cultural barriers by adopting continuous cultural competency and cultural humility policies and training. See, language and literacy barriers continue to be problematic in some cases on the amount and quality of healthcare received for African Americans and other minorities. Language barriers have contributed to negative experiences for minorities and caused misunderstanding in the medical care treatment, and in some cases have resulted in unsatisfactory care. Historically, low health literacy barriers has disproportionately affected African Americans. Discriminatory policies and practices have systemically limited African Americans' access to health information resources. The 2003 National Assessment of Adult Literacy revealed that 58% of African Americans had basic or below basic health literacy, compared with 28% of non-Hispanic whites. Linguistic competence and improvement in the health literacy can help bridge the gap in these areas. D. Attitudes and belief barriers of African Americans in healthcare have been well documented. African Americans' history of racism, mistrust of doctors, experimental research in government has left a lot of distrust with healthcare in the United States. From the early on, African Americans have heavily relied on their family and faith rather than trusting the healthcare system here in the United States. E. Preference barriers of accessing healthcare. African Americans and other minorities are more likely to use emergency departments as their preference of access to healthcare instead of electing care from a primary provider due to cost barriers and lack of healthcare insurance. F. Involvement in care barriers. African Americans' involvement in clinical trials and research have improved over the years, but many African Americans still have a low participation rate due to the past medical experiments and treatment, such as the Tuskegee syphilis study. G. Health barriers continue to have an impact on the African American community in healthcare. Obesity, dietary behaviors, healthy eating, lack of physical activity, environment, and other contributing factors to healthcare relates to health behaviors barriers. According to ScienceDirect.com, data from the National Health and Nutrition Examination Surveys indicate that 45% of African American adults are obese, compared with 30.6% of whites. Consistent with this high prevalence of obesity, several studies have also reported disparities between physical activity and healthy eating in African Americans and whites. H. Education/income barriers are a couple of social determinant barriers that African Americans and minorities face. Studies show that lower levels of education and income have been a barrier of accessing healthcare for minorities. Some African Americans say that they are treated with less respect by healthcare providers because of their income or their race. African Americans tend to make less than whites. So closing the gap in education and income levels will help improve barriers of accessing healthcare. Number 2, C. Structural. A. Availability barriers such as housing, affordable housing, and home ownership continue to affect the African American communities due to racist practices such as redlining. These barriers have had an impact for accessing healthcare. B. Appointment barriers such as missed appointments and no-shows play major roles in African Americans getting appropriate health care. Lower socioeconomic status contribute to affordability and patients having means to make it to appointments. Missed appointments have known to have a negative impact on patients' health. C. How organizational structural barriers to health care have affected African Americans due to systemic inequities rooted in racism and discrimination. And finally, D. Transportation barriers have long plagued African Americans to accessing healthcare. In urban areas and rural areas, the lack of access to public or private transportation can hinder patients from getting to appointments and in return can have a negative impact on their health. Thank you.